Hi guys, Dr. Ken from Activade Health here. Today we're going to be talking about the Hypervolt. I have patients who are often asking me if they should be buying one or if they have one, asking me as far as where they should be using it and what intensity they're going to be using it. Today we're going to be going through and we're going to be highlighting some of those questions to help better answer those for you. So to start, we're talking about where we're using the Hypervolt. Our key areas that we're targeting with the gun is those soft tissue areas, so our muscles, our tendon areas where the muscles attach. We're not trying to go directly over the bone. The bones are very sensitive, so we don't want to be hammering over the bony areas. It's just not going to be comfortable, and at the end of the day, it's just not really beneficial. So important when we're utilizing the Hypervolt, we're thinking about what we're doing, what we're trying to facilitate. Are we trying to loosen up the muscles? Are we trying to just increase some blood flow to the area? So that's also important when we're thinking about how we're using this and when we're using this. So another question is treatment intensity. So if you're familiar with the Hypervolt, you know there's multiple settings on the back there. So we have our first setting, second setting, and our third setting. So you'll see those little lights on the back there flash to indicate the level of intensity. And to be quite honest, when I'm using this on my patients, I'm most commonly just using it on that first setting. So again, I talked about we want to think about when we're utilizing it, what the purpose is that we're utilizing this for. Most often, I'm just trying to help calm a treatment area down. So if my patients are suffering from pain, if you're dealing with a painful area, the lower intensity is going to be just fine. If you start to crank it up and someone's in that acute stage or that painful stage, then by going with really high intensity, it's just going to kind of overexcite or overstimulate that area, causing it to be just more sore and achy. If you're dealing with more of a stiff syndrome, just like really tight muscles, and you want to go on the next level of intensity, you can try that. I'd still recommend starting with a lower level of intensity and then progressing to a higher intensity as you get more used to the Hypervolt and how it works. Now let's talk about when we should be using the Hypervolt. So we already kind of talked about when we're treating a painful area, but there's other great times when we use the Hypervolt as well. Often we talk about recovery work. So a post-workout to help decrease any tightness or help improve circulation post-workout. Another great time would be to use it prior to workouts. So, if you just have an area that is kind of nagging, kind of stiff, like we said, this improves circulation. So before a workout, that's a great time. Get some blood flowing, loosen up the areas, get your body more prepared for exercise. So in regards to treatment duration, as far as the duration goes, it really depends on the surface area that you're treating. So obviously a larger surface area, longer treatment time. Typically I'm recommending no longer than 5 to 10 minutes. Beyond 5 to 10 minutes, it's really not beneficial and you're really not getting anything additional out of it. Lastly, let's just demonstrate how to use the Hypervolt. So we're gonna start off with just a single level intensity. Again, we talked about just coming onto a more meaty area there. So I'm gonna come right onto my thigh muscle, trying to really avoid the side of my hip and on the bony area of my kneecap. With the Hypervolt, if you can see this on the back here, there's also different lights there indicating the level of intensity or a level of pressure that I'm putting through it. So as I sink in deeper, the lights light up further. So that will also help you cue as far as intensity or make you understand kind of where you were doing it previously. So again, we're just kind of sinking in with the Hypervolt onto those meaty areas and then just slowly moving it. There's really no wrong way as far as how you're moving it. If you find an area that's a little bit more tender or sensitive, you can just kind of sit on that area. Or should I say, if it's an area that's just stiffer, you can sit on that area. And then again, just kind of slowly moving side to side, up and down, back and forth. There's really no one direction that you have to be going. Just to be kind of clear that I'm covering all surface areas, I like to just go into like a little pattern where I'm coming out and in, out and back in, out and back in. And this just kind of allows me to understand and make sure that I'm covering the full area. So the key is just that you're really trying to address that full treatment area when you're utilizing the Hypervolt. All right, so just a quick recap. Again, we want to make sure that we're staying and treating on the meaty areas, avoiding those bony areas. Level intensity, I usually recommend starting on the lower intensity, building your way up. If it's a painful area, keeping it on a lower intensity. Again, you don't want to be too aggressive on that area if it's already inflamed. And then lastly, as far as duration, 5 to 10 minutes. And as far as how you're moving the Hypervolt, again, there's no real rhyme or reason. It's just kind of trying to cover the full surface area. You can go in multi directions. No one direction is the right answer. So guys, I hope that helped to answer some of your questions in regards to the Hypervolt and if it's right for you. If you have any additional questions, feel free to DM us, or as always, just feel free to give us a call. Free consultations are available.